Liver cancer. It's a diagnosis that often comes with confusion, fear, and far too many unanswered questions. Is it always caused by alcohol? If it is, can it be cured? How do you even know if you have it? And why does it seem to hit some communities harder than others? Welcome to Untangle, where we break down the complicated, challenge the myths, and get to the truth. Today, we are fully untangling liver cancer from risk factors like hepatitis infections and contaminated food to stigma and late diagnosis. This is a medical issue, a public health challenge, a policy question, and for many, a deeply personal story. So let's find out the causes, how it's treated, and why understanding it might just save lives. I am Amadou Nobewe. Welcome to Untangle. All right, welcome back. We've been joined now by one of the foremost experts in the field, Dr. Lukman Abdulkareem. He's a chief consultant, physician, gastroenterologist, and hepatologist at the University of Abuja Teaching Hospital. He is also the chairman of Enlightenment Initiative on Viral Hepatitis. Welcome to the program, sir.
Yeah, thank you very much. It's my pleasure to be here.
All right. So, liver cancer is an issue that some persons might not take too seriously because they feel, it's something they might never have to deal with. So let's start from the basics. What is it and what leads to it?
Okay, now liver cancer is, like cancer in any other part of the body. Cancers are abnormal cells. When these cells begin to multiply abnormally and they get out of control and they form a mass in the liver. That's typically what we call liver cancer. And it's difficult to say one person may have it or another person may have it. People have various risk factors that could possibly lead to liver cancer. So it's not absolute that somebody will have it or not. But it's based on these risk factors that may determine who may have liver cancer, or not.
All right. So let's go into those risk factors now.
Now, looking at the risk factors for liver cancers, foremost is the viral hepatitis, which is of major concern. We have the hepatitis B, we have the hepatitis C, and along with B, we have some people that may have hepatitis D. When we look at viral hepatitis, we have hepatitis B, C, D, and E. A and E are not much of a problem because they don't usually stay long in the body. Usually within 6 months, the body is able to eradicate A and E. But when we look at hepatitis B and C, those are the ones that could cause long-term infection, that will cause chronic infection. And when there's chronic infection of hepatitis B and C, hepatitis B or C, there's this long-term damage to the liver cells, which could lead to cirrhosis and could lead to liver cancers. Now, hepatitis D, that can't survive in the body, except in people that have hepatitis B. So some people may have hepatitis B alone, some may have hepatitis B and D. And of course, hepatitis B, if it's occurring with D, increases the risk for developing a cirrhosis or developing a liver cancer compared to those that have B alone. Now, that's the viral hepatitis. Closely followed by alcohol. Alcohol could cause alcoholic liver disease, fatty liver, alcoholic cirrhosis, which could lead to a liver cancer. Thirdly, in our environment, we have what we call aflatoxins. These are like toxins produced by some molds, which could be found in grains. Poorly stored grains, typically poorly stored groundnuts, could have these molds producing aflatoxin, and by the time people consume this aflatoxin, it's a toxin that could, predispose to liver cancer. There are other causes. Virtually anything that can cause a long-term liver disease that will cause chronic liver disease may lead to a cirrhosis and may lead to a liver cancer. We have what we call autoimmune causes. We have hereditary causes, genetic causes, a number of causes. The other toxins too, like some chemicals in paints, some petrochemicals, that if people are exposed to may also lead to some, form of liver cancers.
All right. Maybe a couple of clarifications there, particularly for someone like me who likes groundnuts. So, you're saying poorly stored groundnuts can lead to some of these toxins.
Yes.
So is it about the quantity of toxins or is it the moment you have just a taste you are now more highly predisposed, or is it continuous?
Yes, well, I can't really say the quantity of the toxins, but the fact is that when people have a long-term exposure to these toxins, some may have some genetic predisposition already to developing liver cancers. Some may have multiple risk factors, like somebody that has hepatitis B, now exposed to these toxins, of course, the risk may be higher. And when it comes to groundnut or other grains, the typical thing we ask people is that when you eat this groundnut, do you see molds? On the groundnut. Some will see it and just clean it up, blow it up and eat. Those are like storedly poured groundnuts. Similarly, grains. But if they are properly stored, you don't see molds on them when you are consuming them. We don't expect them to have, these molds that cause, aflatoxins.
All right. Do you have the numbers or perhaps a general overview of the prevalence? Do a lot of people get liver cancer, or is it a very rare thing? Also, are there people more predisposed? For instance, we hear that in another topic now, for something like breast cancer, we are told that women of African descent are more likely to, have, danger, to end in fatality or something like that, while Caucasians not as much. So when it comes to liver cancer, what's the general prevalence, and is there anybody who is more at risk based on just identity, so to speak?
Well, now looking at the prevalence, it has a global distribution. It's worldwide. It may just vary from one region to the other based on the predisposing factors. It's considered to be the sixth most common cancer worldwide. And putting a figure to it is about 8% per 100,000, per year, which is quite, high figure. But when we look at different regions in the world, when we look at like sub-Saharan Africa, Southeast Asia, we look at viral hepatitis as being the predominant factor. When we look at the Western world, we look at hepatitis C and alcohol being the predominant, risk factor. So it may vary from one region to the other, but generally it's taken to be the sixth most common cancer, worldwide.
All right. So let's talk now about what people can watch out for. Are there symptoms that are obvious, or is this something where it's a silent killer where by the time you are seeing symptoms, it's probably quite late already?
Yes. In fact, that your last statement is you've hit the nail on the head. When people notice symptoms, it is quite late already. Now, when there's liver cancer, it could be cured in the sense that when we diagnose early cancers, such people could have surgery that could remove that part of the liver that has a cancer, or have a liver transplantation, in which they get a new liver and the diseased liver is removed. But for us to get such people in the early stage, it's really difficult. Most people, by the time they have symptoms, mainly they start having weight loss, they start having pain in the region where the liver is, that's in the right upper abdomen, or they start noticing any form of symptoms, it's already quite advanced. Just to share an experience, recently I had a patient who was otherwise healthy, only that he was hepatitis C positive for a couple of years. I think for the past 10 years, he knew he was hepatitis C positive, had no treatment. And just, okay, let's evaluate you to treat this hepatitis C. Otherwise, he had no symptoms. And when we asked him to do certain tests, including abdominal scan, he had a tumor in the liver, which was just about 5 by 6 centimeters. And he was like, doctor, but I'm not feeling anything. I said, yes, we don't want you to feel anything. Because by the time you start feeling something, then it is advanced. Most people, before they have symptoms, the tumor is about 10 centimeters or more. Some people have tumors that have riddled the whole liver. And at that stage, they are no longer candidates for surgery. They are no longer candidates for transplant. And these are the two curative treatments. By the time the have symptom is advanced, all we can offer is some form of therapy to perhaps prolong life further. So when people have symptoms in liver cancers, it is advanced. And at that stage, the outcome looks quite poor. Now, for us to diagnose people in the early stage, these are people that maybe come for regular medical checkup. People that we know have hepatitis B and C, and they're on a surveillance. Surveillance in the sense that we ask them to do abdominal scan, ultrasound scan, like every 6 months. We ask them to do what we call alpha-fetoprotein and some other checks every 3 to 6 months. So in such people, we may be lucky to diagnose them early. I've seen a patient on surveillance like that in which we were able to diagnose a single tumor of 2 centimeters. And he went on to have a therapy in which he even lived for several years, afterwards. So early diagnosis is key But early diagnosis is very difficult. By the time patients have symptoms, I keep emphasizing this, it is already quite, advanced.
So regular checkups is advised.
Regular checkup is advised, particularly for those that have hepatitis, those that have alcohol, or those that have any form of liver disease. They should have regular checkup to be sure no cancer develops in the liver. And if there's any cancer, they should get the treatment as soon as possible.
All right, let's quickly talk about survivability or fatality, so to speak. For people perhaps who are not able to detect early, and even those who are able to detect early, is there a certain percentage of survival rates? Even the ones that come late, what then happens for them?
Okay, now, for those that come early and they're able to undergo a curative therapy, they can live so many years after. For those that are not able to undergo curative therapy, perhaps they are able to undergo what we call locoregional therapy, in which we try to kill off the liver mass, the tumor. 5 years survival is about 5%, and it depends on the stage, really. For those that have advanced disease, we usually grade the disease from stage A, B, C, D. Those that have advanced disease, the survival rates, 6 months survival is very poor in such people. But those are able to undergo some form of therapy, 5 years survival is, quite good, 5% in 5 years. Quite good, yeah.
That's really interesting. Maybe we'll talk more now on preventive measures and what people can do to protect themselves. But we'll go on a quick break. And when we return, we'll delve into the other aspect of liver cancer. Don't go anywhere.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate, and preserve the arts and culture that define us. Welcome back. I'm still here with Dr. Lukman, and we've been talking about liver cancer. So let's go straight into, before preventive measures and all of that, let's talk about the treatments you talked about. You talked about therapy and transplants. There are some conceptions about transplant. I don't know if you can just help us break it down. There is a belief, perhaps it's true, you can confirm for us, that the liver, is one of the most regenerative organs in the body. And people say that transplant sometimes doesn't involve the full liver. You take a little and then you put it and then it grows. Is there any truth to that? And if it is, why is that something that is doable?
Yes, well, the way God created us, when we talk about kidney transplant, we know that we have two kidneys. Yes. One donates one, survives on one. Yes. The recipient survives on one. And people look at the liver as, it's a single organ. But at least, thank God, people are more aware now that despite being a single organ, it has two lobes, attached together. And each lobe has 4 segments. So somebody that needs a liver transplant, the diseased liver is removed, and the donor donates just a portion of his own liver to the recipient. And when the recipient receives that, the liver grows to fill the space meant for the liver. And the person that donated, the liver grows back to the full size. I've even seen a person that had a liver transplant before, and by the time he did the scan, after about 2 or 3 years, he had a full liver, only that it wasn't in 2 lobes, but it already filled the space. So these are things we tell some of our patients because some people may believe, the liver is one. This person needs a liver transplant, or is he going to kill the other person and run away with his liver? No. So one can donate a portion of the liver to the person that needs it. So it's a win-win situation. The person that needs it, the liver grows, fills the space, and the donor, it also grows to fill the space. So you are right about that.
Oh, fair enough. Sometimes we want to confirm what people are thinking, whether it's true or not. But before we move further, in your experience, what you've seen so far, handling different cases and also doing enlightenment on all of this, are there some misconceptions that pop up regularly where people think things are a certain way, but that's not the truth of it?
Well, in our African setting, when people have such very terrible diagnosis, first thing they think of is somebody somewhere that has caused this, and we try to educate people about the risk factors and let people know that, you've had this condition before. This is probably what led to a chronic liver disease leading to, this liver cancer. So as to disabuse people's mind that it's not the people from the village, that is causing it. We've had a patient who, I think about 4 or 5 siblings had liver cancers, one after the other. And in their village, they just felt, that's family, all their sons are always dying, but we understood that they all had hepatitis B and possibly maybe they had a genetic predisposition, to that. But in the village, they just labeled their house as being a family where all their sons have been, dying. So there could be some of those misconceptions, but understanding the science behind it, may help to erase, some of those things. And I don't know, maybe there are perhaps some other misconceptions you've heard that you want us to clarify.
Well, I don't know if it's a misconception, but there's a heavy linkage of alcohol with liver cancer. The moment someone is seen abusing alcohol, they say you're going to end up, as though it's a certainty.
Well, I wouldn't say it's a certainty, but when people consume significant amount of alcohol, it could lead to alcoholic liver disease. And alcoholic liver disease is a spectrum.
Did you say alcoholic?
Alcoholic liver disease is a spectrum in which we have the alcoholic fatty liver, which could lead to alcoholic steatohepatitis when the liver becomes inflamed. And this could lead to alcoholic cirrhosis. And when there's cirrhosis from any cause, whether alcohol or hepatitis or other causes of cirrhosis, the cirrhotic liver could lead to a liver cancer. So it's not just only alcohol. There are so many other risk factors, for liver cancers.
I'm wondering if you can break down that word. You've used cirrhosis a couple of times here. Is there a simple way to explain what that means?
Okay, no, cirrhosis simply means that the liver becomes stiff. It becomes hardened. We know when we see the liver, at least we've seen animal liver before, it's usually soft, smooth, and succulent. But in cirrhosis, because of the repeated damage to liver cells, the liver tries to regenerate, but there's scar tissue formation. Like when we have scars on our skin, we know that the scar at times could be hardened. So this attempt to regenerate and the scar deposition in the liver makes the liver to become stiff. And when the liver becomes stiff, there's still further attempts at regenerating. The blood supply, blood flow through the liver becomes distorted. All this is what we call cirrhosis. And because of that regenerative capacity of the liver, some of the cells in the regenerative areas could just go haywire. Those cells may just become cancerous. But if we have a normal liver in which there's no strong attempt at regenerating, then the liver may just remain normal. So cirrhosis just means that the liver becomes stiff, and it becomes stiff and hardened. That's what, and this could result from any long-term liver disease.
All right. Yeah. So what are the preventive measures? We've spoken about regular checkups, but are there things, lifestyle changes, things that people can do that at the very least, if not removing it completely, helps them at least avoid something like this?
Okay, now when we look at preventive measures for liver cancer, I think the first is for people to even be aware, to be educated about it. And once they're educated about it, topmost is hepatitis is preventable. In fact, when the vaccine for hepatitis B was discovered, some newspaper labeled it the vaccine for liver cancer. And the simple reason is that majority of liver cancers are caused by hepatitis B. So when you get a vaccine for hepatitis B, you are indirectly getting a vaccine against majority of liver cancer cases.
Yeah.
So some countries have tried the mass vaccination, in which they vaccinated a large majority of the population, and they found that over years, 10, 20 years, the incidence of liver cancer actually reduced. So vaccination against hepatitis B is a major preventive factor, because if you're able to prevent people from getting hepatitis B, then you're able to prevent a lot of liver cancers. In our environment, hepatitis B accounts for up to 60 to 70% of liver cancers. So if you can prevent that, you can prevent them from getting liver cancers. Now, childhood immunization, we already know that hepatitis B vaccine is part of the childhood immunization. So we should encourage the newborn babies to get vaccinated. But for adults, that's where the problem is. Adults should get screened. Once they are negative for hepatitis B, they should get immunization. And that will prevent any future infection of hepatitis B. So for adults, it's very important. Now, other infections like hepatitis C is curable. So when people get screened and they should get treated for hepatitis C. Once they are cured for hepatitis C, that significantly reduces the risk of developing a liver cancer. Alcohol, which is about the third most important thing, it's difficult to tell people to stop alcohol. Yeah. What we tell our patients mostly is that they should cut down alcohol, to as little as possible, with the aim of trying to stop alcohol. And when people already have alcoholic liver disease or cirrhosis, we just have to tell them to stop the alcohol intake. If they don't stop it, then it may progress, they may develop a liver cancer. So for people generally, we just advise moderation in alcohol intake. Try to prevent exposure to toxins. Check your grains very well, check your groundnut very well. Be sure there are no molds in this, in these grains. Then other chemicals that people could be exposed to, you try to avoid that as much as possible. Then when people have any form of liver disease, they should see a specialist. They should get to know if they need to be on periodic checkup, in order to prevent liver cancers, or even if a cancer develops, so it can be detected early, and so that they can have curative therapy if detected early. And I think generally health education very important, which is what we are doing now.
Fair enough. But within Nigeria here, are there any recommendations you have where people can go, or things they can do, and not possibly in terms of how accessible these things are? I remember when we had an earlier episode on hepatitis, one of the advice we also gave people is that they can also watch out for the World Hepatitis Day, where usually loads of free screening is everywhere, even if maybe you had to pay for it before. So are there any things that, things available that people can lay their hands on? You can start with the country here, that they can do to help themselves.
Okay, now when it comes to particularly hepatitis screening, there are lots of programs, go on every now and then. You see people in maybe religious places, the mosque, the churches, doing free screening program for people. You see offices doing free screening program for people. Then we have various World Health Days, like the World Hepatitis Day coming up next month, in which there will be a lot of free screening virtually in every state in Nigeria. We have our association, the Enlightenment Initiative on Viral Hepatitis, and our presence is in at least 4 states. And every World Hepatitis Day we do screening program. People can watch out for this. Our Gastroenterology Society, that we call Shogin, that's the Society for Gastroenterology and Hepatology in Nigeria. Our members are in almost every state. We also have free screening programs, at least some form of public enlightenment, during this World Hepatitis Day. In April, we had the World Liver Day, in which some centers also did, free screening program and enlightenment program. Our own NGO, we had a webinar in which people were free to join from all over the country, all over the world, and people were educated, on hepatitis. So people should watch out for some of these programs. If you get to see your doctor for any reason, you can just chip it in. I've not checked for hepatitis. Why not screen me for hepatitis? Some people may feel lost. If I have no symptoms, then I don't need to check. But that is the right time to check when there are no symptoms, so that one could be treated appropriately if there's hepatitis B. Once symptoms are developing, as I said earlier, it may be a little too late. So we should just take our health into our hands and get, tested today for hepatitis B and hepatitis C.
Indeed. And I just want to go back quickly, maybe in case we might have missed this. The risk factors you've mentioned and some of the potential causes are a number. So I'm wondering, are there different types of liver cancer? as well?
Okay. Yes. Well, when we talk about liver cancers generally, we mostly refer to what we call the hepatocellular carcinoma. That's cancers arising from the liver cells. That's well, medically we call it the hepatocytes. Now, when we look at liver cancers generally, we can look at them as primary liver cancers or secondary liver cancers. Secondary liver cancer simply means cancer from another part of the body that spreads to the liver. At times we call that liver metastasis or hepatic metastasis. It could be from the colon, the breast, any part of the body that has the cancer, potentially it could spread to the liver. Now, for primary liver cancers, those are cancers that originated primarily from liver cells. Scientifically, there are two major cells in the liver. We have the hepatocytes, which could develop hepatocellular carcinoma, which is the commonest type of primary liver cell cancer, accounting for up to 80% of liver cell cancers. But then we have the cholangiocytes that lines the bile ducts. And this cholangiocyte could develop what we call a cholangiocarcinoma. Those ones are less common. Then we have the one we call the hepatoblastomas. Those ones are usually liver cancers in children. So we don't have them in adult life. It's usually in children that could have hepatoblastoma. Then less commonly, we have the one we call lymphomas. So there could be some hepatic lymphomas too. And also less commonly, we have the ones we call the cystic adenocarcinomas. Those are like liver cysts. They look like fluid-filled spaces in the liver, but the cavity is lined by cancerous cells. Those ones are also not so common. So the commonest that I said earlier is the hepatocellular carcinoma.
Is there anyone that's more dangerous than the others?
Well, I would say hepatocellular carcinoma and cholangiocarcinoma are more dangerous.
All right, fair enough. Thank you so much for breaking it down. I believe we've enlightened people on, symptoms, causes, things they can do to prevent it, and they also have information on how to forestall this and help themselves. Are there any other things you'd like people to know or any more?
Well, concerning treatments, treatment could be very challenging. When we talk about curative treatments, people to undergo liver surgeries, there are not so many centers. So this is where we advocate for training. We need more doctors, more surgeons to be trained on liver surgeries. I recently had a patient who I had to refer to a surgeon. The one I told you had a 5-centimeter mass in the liver, and is going to another state. It's going to another region of the country to potentially get the surgery done. You understand what that means. He has to travel, maybe with family, stay in another state for a long period, to have his surgery done. Well, that's even better. For transplants, there's no center in the country that does the liver transplants. I once went for a conference outside the country, and they couldn't just understand that you don't have a single center doing a transplant. So this is where we call on, government, non-governmental organizations, not just government alone, to get doctors trained in liver transplant surgery. Not just training, the facilities, because the training is just a minor thing, but to get the facilities to be able to successfully do liver transplant in the country. These are very expensive procedures. By the time people travel out of the country to do it, by the time you add the cost of flights, accommodation and all that, it's really, really expensive. Most average Nigerian would not be able to afford it. That aside, the other part we also need to look into the preventive measures, free testing for people. We should get the government, non-government organizations to make it standard. The era of HIV, testing was everywhere. And we need that to also occur for hepatitis B and hepatitis C.
Thank you so much, Doc. It's been a pleasure.
Okay.
Thanks for enlightening us.
Thanks a lot.
All right. I do believe we've all learned a thing or two here. I certainly have. We've been talking about the 6 most common cancer, liver cancer, and we've broken down all you need to know. Do ensure to take this advice. By the way, I should note, whenever we're having medical conversations on here, it does not stand in for consultation. So you do need to still go to your doctor and, have your own personal consultation with them. This is for informational purposes, and we're just trying to enlighten the public. Do join us once again right here on Untangle every Monday by 10 a.m. See you next time. I am Amadine Ubewe. Bye for now.